Today, I'd like to talk about how to find an expert in PANS and PANDAS to treat your child. What should you look for? Where do you go? How do you find these folks? And so, PANS and PANDAS and their treatment is becoming more prevalent in society. People are kind of waking up to the idea that these are real clinical entities and you need help. And so you may be overwhelmed because if you were to type that into the internet, you may get a thousand people trying to sell you things and get you to come and see them and advertising themselves as experts. So the question is, what do you need to do? Who do you need to look for? So the first thing I would say is this: you need to find someone with experience, someone who's seen multiple patients with this. It's important to look at people's um, information and credentials. It's important to find someone with full prescriptive rights, someone who can write for prescription medications if needed, someone who can write for radiology testing in case an MRI is needed, and also someone who can communicate with other medical professionals as a peer. So if the patient needs to see a psychologist or they need to see a gastrointestinal doctor because they're having trouble swallowing, all those things happen. You need to have someone who has their credentials and is able to communicate with folks as a peer. So I would always suggest that to make sure you have someone who's qualified. I understand there are many people on social media who advertise themselves as being experts, and it's hard to filter through. But just that's a good place to start. The second is to look at the PANDAS Physicians Network. There are many providers listed there, people of all sorts of training, but people with full prescriptive rights that can help you. The third thing that I would suggest is finding someone who manages things with a not a protocol based approach, but an organizational based approach. In other words, even if you find someone to take care of your child who says that they treat PANS and PANDAS, sometimes you may find that all that they have to offer are antibiotics, IVIG, psychiatric medications, or steroids and et cetera. The problem with that approach is that many of those patients that have been treated that way will end up at my office because they're not better. And so there's several reasons for that. The first is that sometimes people will only focus on strep, and actually it's much bigger than that. I would say um, all other causes kind of dwarf strep. In other words, strep alone as an agent in our practice is probably less common than things that aren't strep, things like mycoplasma, Epstein-Barr virus, Lyme disease, Babesia, Bartonella. All of these things can be really important causes of PANS in patients. And so if people are only treating one particular thing, which is strep, antibiotics that treat strep don't typically cover even mycoplasma well. And many times people will say, well, I'll just use azithromycin, which will cover all of these things. But we're also seeing a lot of strep resistance to azithromycin, especially in the Midwest right now. And so you really have to have a good idea and an organized approach to figuring out what's the right antibiotic, if anything at all. In addition, it's very helpful to use other adjunctive agents, things like herbal medications, which can help you get someone off antibiotics sooner. Using things like biofilm disruptors is important as well. And so, biofilms, think of like a protein goo that is made by the organisms that kind of protects the organisms from your own immune system and protects the organisms at times from antibiotics and other things you're doing. And this is sometimes what's behind people who say, well, my child was fine on antibiotics. I got them off. They got sick again. So there's several reasons. One of them is biofilms. And the other reason is that the person still has some form of immune dysregulation. And dysregulation, I mean overactivity at times of the immune system, underactivity at times, kind of like a teeter-totter seesaw. And so to fix that, we use several things. You can use steroids, although many times children, especially if they're anxious or aggressive, will get worse with that. The ultimate immune re-regulator is intravenous immunoglobulin. Only about 10% of our patients need that. Certainly not needed in every patient. But we use also in virtually all of our patients with PANS and PANDAS, we use low dose naltrexone. Low dose naltrexone is a medication that's compounded based on the dose. And if you look at that, too much, too little of the immune system, LDN tends to balance things. It's also been shown to help behavior in autistic children. There's many things. And even in adults, low dose naltrexone will help reduce symptoms with certain autoimmune diseases. It's been studied in rheumatoid arthritis and Crohn's disease, fibromyalgia, all of those things can be beneficial in. So that is another thing that we do at our practice. And then we also look at specific things to work on neurologic looped behaviors. It's important to see someone who understands how the OCD brain works and can give you specific details about how to do exposures and deal with anxiety. We do non-invasive vagus nerve stimulation in all of our patients with PANS and PANDAS if they tolerate that. And it is really, really helpful. This is an underutilized part of the treatment of PANS and PANDAS. And in most cases, just antibiotics and IVIG, et cetera, aren't enough. So you really need to find someone with an organized approach. You can find more details on our approach by going to thepandasdocs.com. There you'll find a wealth of blogs and things to look at absolutely for free, which will talk about the testing we do and the treatment we do and additional unusual topics like mold exposure and what that has to do with PANS and PANDAS. You'll also find a link to order my book there, which is the Comprehensive Physician's Guide to the Management of PANS and PANDAS. You'll find it cheaper than on Amazon there. And so we can get you that information as well, which contains all sorts of information about our approach. Informs it's a good thing for clinicians to have because it can get them started seeing their very first patient. You'll also find really helpful information on the PANDAS Physicians Network, and especially some additional information for what to do and how to see your very first patient. So I hope this information was helpful for you. Thank you.